Started here. So we'll continue talking about elbow disease. Ashley, why don't you take this case?
Hello, can you hear me?
Yes.
Okay. Just looking here, we have two sagittal views. I'm trying to find the biceps tendon here. I see some fluid. I think I see a biceps tendon within the mid portion, but right there, yeah. I would have to scroll through this a little bit more. Is this the brachioradialis?
Yeah, that's the brachioradialis. Here are the axial images.
Okay. Now we're kind of, I see a kind of thickened biceps tendon at the insertion.
Okay.
Right there, yeah. Looks like there might be, and then the brachioradialis it's not attaching appropriately.
Yes.
There might be torn.
A partial tear, the brachioradialis.
I'd have to scroll through this.
Insertion and not the biceps. Uncommon injury, but it's important, obviously, to distinguish between the two. Okay, Michael, here's another patient.
John, is that because you can see the fluid more laterally?
Well, here the sagittal image, we can see whatever this is coming down and attaching to the ulna, not the radius, so it must be the brachial.
Yeah, right, that's for sure. But on this image, the axial one,
yeah.
Oh no, on the coronal one, if you go to the right, I mean to the left, I'm sorry, to the left, right in the center, right there, there's a lot of edema there, isn't there?
Well, there's a lot of high signal intensity here. It's mostly fat.
Okay, so that's not.
Yeah. On this sequence, fat and edema have similar signal. We have high signal fluid here. This is where the muscle of the brachialis should attach to the bone here, and this is
right on the edge.
Yeah, right.
And distally.
Yeah. And then, and you can also, coming back here, you can see that the muscle fibers are going all the way down to the bone here. Pretty careful.
So it's a partial tear.
Yeah, partial tear, right. Michael, what do you think of this patient who has anterior elbow pain? Also an athlete.
Okay, so I see kind of a lot of edema and thickening kind of at the myotendinous junction of the brachialis as it goes to attach to the ulna.
Yeah, and then here we can see abnormal signal intensity within the distal.
Yeah, it looks like it's intact, like the actual tendon. So this is like a strain at the myotendinous junction.
Yeah.
Or, yeah, like partial thickness tearing, muscular.
Exactly. Right.
All right, so we have a 59-year-old male with pain and swelling, bruising along the biceps for 3 days after increasing golf. I think here it looks like we're at the level of the forearm. I see it looks like retraction of either a tendon or muscle in the mid forearm. I'm not sure where we're at here. If it's bursa or like a bicipital radial bursitis, or
this is really in the brachialis muscle distally here.
That's the forearm.
No, this is the elbow's down here.
So it's quite a ways from the elbow.
It's proximal to the elbow. We can see.
Yeah.
There are other images, T1 weighted images here. Here you can see the elbow down here, and then signal changes here. Jennifer, what do you think this is?
Okay, so here it looks like if we're, again, I think in the region of the brachialis, and it looks like a full thickness tear with retraction and edema.
Oh, this is a grade 2
Tear.
With some hemorrhage into the muscle belly, not a grade 3. Yeah, right. Of the brachialis. Great. And so
I don't think that practice helped this guy much.
it ruined his trip to Scotland, John.
Pardon me?
It ruined his trip to Scotland.
Yeah, I would think so, because that's a painful injury.
Yeah.
He must have hit the ground pretty hard.
Right. Okay. Michael, what do you think? Or who's Ashley? What do you think of this one?
So here, let's see, I can't really see it. 1 second, sorry. So is this the brachialis again? Is there fluid within the brachialis? Looks like at least a grade 2 muscle strain, and there's a fluid level. There might be some hemorrhage there.
Yeah, and this is another brachialis tear, more severe brachialis tear with focal areas of hemorrhage and fluid in it compatible with a grade 2 tear. Right. Good. Michael, what do you think of this case?
Okay. So I see a lot of edema and signal involving kind of over in the maybe one of the flexor muscles. So that looks like at least a partial muscular tear strain.
Right.
Flexor digitorum.
Posterior to the Pronator Teres, so this is the Flexor Digitorum Superficialis. Good. Okay.
All right, this is a Major League Baseball player with elbow pain, and now we're here at the lateral side of the elbow. So it looks like a strain of the extensor muscles. It could be the extensor carpi radialis brevis or longus. Okay. Yeah.
Okay, so this is on 6204. The patient came back with pain again 4 days later, and this is what it looked like.
Okay. So now we're over here on the medial side of the elbow. So this is probably in one of the flexor muscles, like flexor carpi ulnaris, pronator teres. Okay.
So we talked earlier about teenagers not stopping when they're told to stop, and here's an adult with the same problem. He continued to do batting practice and then strained the other side of the elbow. Okay, Ashu, what do you think of this one?
All right, so here, I think I don't really see the biceps tendon very well here, and I see some fluid within the bicipital radial bursa. I'm worried about at least a partial tear.
Okay, yeah, certainly flex the arm, you'd be concerned about the biceps. You also have to be concerned about the brachialis, which, as John said, is actually a more important muscle for flexing the elbow, and there is some fluid here. But notice also that you've got a lot more edema in the supinator muscle. What's this muscle?
The supinator? Or?
Yep. And then here, this is the edema within the supinator there. And that was a supinator muscle tear predominantly. And you got a little fluid extending into the bicipital brachialis bursa here, but it was due primarily to a tear of the supinator.
Can you tell, John, if the biceps supinator attachment is involved in any way on this?
Does the biceps attach to the supinator?
No. I'm talking about its attachment to the radius.
Well, this is kind of a diffuse. It's kind of a diffuse injury. I'm not sure that it's specific just for the radial attachment or not.
Yeah, you can't see the tubercle. Because if the supinator is injured, there must have been probably a strain on the biceps too.
Yeah, I don't remember. I don't remember.
Well, we won't know, will we?
Right.
Unless you have a cut across that tubercle and the radius.
I don't, and I don't remember that. Okay, good. And then here's another supernator there where we can see the edema.
Would you be a little worried about the radial? About the biceps if you have a supinator tear?
Yes. Yes.
Yeah, I know I would. I think
the two are synergistic with each other, right? Okay, Michael, what do you think of this case? Patient has posterior elbow pain.
Excuse me?
The patient has chronic posterior elbow pain.
Yeah, so there's abnormal increased signal involving the triceps at its Olecranon attachment. Yeah. And it doesn't look, triceps tendinosis, kind of deep fibers.
Yeah. The main reason I put this in is to talk a little bit about this. Almost always, the triceps tendon attaches to the olecranon on strips. So if you look on the axial images, you'll always see increased signal intensity and stripes all the way down to the triceps insertion, and that's normal. That's not abnormal. And if you see in the coronal images, you can see it kind of the black tendon coming down in kind of fingers. But you shouldn't have confluence of the signal like this. If this high signal here goes all the way through, that's fine. But to have confluence like this, where you break up the longitudinal low signal regions, is abnormal. And this patient had chronic symptoms from really chronic partial tearing with granulation tissue and attempt to heal it, a thing that we just call tendinosis. Right. Okay.
All right. So hit by a pitch 5 days ago, now he's unable to throw, and they did place an overlying soft tissue marker. There's a lot of edema in that triceps muscle. It looks like at least a partial thickness tear of the triceps muscle or grade 2 injury and some hemorrhage.
This was just a contusion. But it was very painful. But he was actually back playing about a week later. But it was painful at the time. So, and contusions like this tend to be kind of uniform in signal, like this, as opposed to this next case. Actually, what do you think's going on here?
This is more feathery. You can kind of see more fluid kind of extending through the triceps muscle, and you can kind of see the separation of the fibers there. So I'd be worried about a muscular strain and some partial tearing of the muscle.
Right. So this would be a grade 1 because you don't see fluid collection. This is just kind of feathery, like you said. There is a little fluid collection, but it's in the subcutaneous tissues, not in the muscles. So this would be a grade 1 tear of the muscles. Michael, what do you think of this case?
Okay, so this looks like there's a complete full thickness tear of the triceps. There might be it looks completely torn and retracted.
Yeah, so this would be a grade 3, right? John, what would you do with this?
Attach it.
Okay, so this would be a surgical case.
Yes.
Yep, because it's at the.
That's not going to go down like the Achilles tendon and heal. This needs surgery.
So here we can see some fluid signal intensity along the posterior elbow. I'd be concerned about Olecranon bursitis, and there is some debris present. The triceps. I don't see the triceps very well. I guess this could also be. This is a complete tear. Yeah.
When you say bursitis, that's not quite where the bursitis is. It would be superficial to the muscle and olecranon. So this is a hematoma or fluid of one kind or another.
Yeah, right. Actually, what do you think?
Hey,
Asher?
Yeah, it looks like there's a complete rupture of the triceps tendon here with significant fluid, and there's some retraction of the triceps tendon. You see it a little bit more superiorly. And I think there might be a bone fragment, actually. I think this might be an avulsion fracture.
Yeah, so this is a triceps bone avulsion, and pointing out the little bone fragment there is important.
Fractures, in my experience, have been far more common than tears.
Okay.
Mainly because people fall and land on that olecranon and they fracture. And usually it's an older population rather than a young population.
Right.
In a young population, the weekend warriors, in terms of sports, they tear the tendon.
Yeah. Good. Michael, what do you think of this case?
Okay, so it looks like there's a triceps olecranon avulsion fracture with kind of a complete. It looks like it might. I'd want to see the axials to see if it's like a complete avulsion. Yeah.
This has kind of an older appearance also. For some reason, it looks older to me. How about you, John?
Yeah, I think so. Yeah. Yeah, a little bit of hibernation here. We don't.
Yeah, there's something. It probably had been an injury before, and there's a little more.
And a portion of the muscle is still intact. The tendons are torn. The triceps can be partially tendinous, partially muscle. It has a lot of combinations, or it can just be all tendon with just those little strands in it. But the interesting thing, when you see that it's a combination of muscle and tendon, the tendon can tear. The muscle is more resilient, so the muscle may not necessarily tear when the tendon does. And that's
I've never seen a case like this. Maybe you have, John, more than once, but I never have.
Yeah. Well, I think it's hard to detect without an MR.
Right, so this looks like another complete tear of the triceps, and there is cortical irregularity along the olecranon. I don't see the ossific fragment, but I think this is concerning for an avulsion. Yeah.
Corrosive change there, but you can see all the sclerosis and probably a lot of granular.
What's that structure in the posterior aspect? Oh, wait a minute. That's fluid, isn't it?
Yeah.
Yeah. Sorry.
Okay.
But that does look like there's a piece of olecranon missing.
Yeah, that's right. There's erosion here, but we didn't find a piece of bone. This was chronic. This has been
strictly chronic degeneration.
Yeah, he's had symptoms for years.
Yeah, that's not a young person, probably.
Right. Yeah. Okay, why don't we stop here for this lecture, and then let me log back in with the next lecture.